clearly we've seen dramatic response rates with CAR T cell therapy and I'll take an example of large B cell lymphomas, which, these patients are now treated with CAR T cell therapy. But most of the trials, which include Zuma 7, Transform, have looked at uh, these therapies, whether it's Exicel or Lysocell, Exicel for Zuma 7, Lysocell for Transform, which showed tremendous improvement of the standard of care, which is traditionally chemotherapies, after patients have failed the standard lines of therapy. Response rates have been tremendous. We have seen response rates in the ballpark of 60 to 80%. However, we do know that post CAR T cell therapies, patients do formulate resistance. There are a number of mechanisms of resistance, and a common one that we see is actually the antigen loss of CD19. In fact, there's work from US Lymphoma Consortium saying when they looked at 61 patients who were treated with CAR T cell therapy, 18 of them became CD19 negative. So the next line of CAR T cell therapy is essentially looking at, dual approach where you're doing a co-administration, whether it's an anti-CD19 or an anti-CD20/22 approach. You can also do so this would be co-administration, defining a CAR T for each of them, or you could have a co-expression approach, or you could even take the bivalent bispecific approach. So I think the next line of CAR T cell therapies are going to be really exciting and focusing on these aspects. And then the other aspect is going to be the CAR T cell therapies are now being looked at in upfront cell therapy. So initially the trials were done beyond 2 relapses. Then it's obviously now directly after the first relapse. And the current line of trials are actually looking at upfront value of these CAR T cell therapies. So I think 2 things will happen. Overall, CAR T cell therapy is moving earlier in the treatment paradigm for these patients, but also improvement on the CAR T cell therapies in terms of going after 2 targets rather than just 1 to improve the efficacy, but also making sure that the durability of response is higher so that our patients can not only get benefit from these therapies, but also have a prolonged benefit from these therapies.